Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Thrombolysis or the ischemic stroke, we are looking at the indications as well as the contraindications. So now we start off with the indications. So in terms of indications, it includes the clinical diagnosis of stroke. So CD of stroke. Next is the onset of symptoms. So onset of symptoms. So onset of symptoms to the time of drug administration. Onset of symptoms to the time of drug administration. So administration, it is less than 3 hours. So it is less than 3 hours to 4.5 hours. Next, when you look at the age, the age here is nothing but greater than or equal to 18 years. Then when you look at the CT scan, the CT scan of the indication of thrombolysis of stroke, it includes the showing of no hemorrhage or edema. So there is no hemorrhage or the presence of edema, and of greater than 1/3 of the MCA territory. So greater than 1/3 of the MCA territory. So we saw about the indications, and now we'll look at the contraindications. So here in terms of the contraindications of the thrombolysis. So contraindication of thrombolysis of the stroke. So what does it contain? So this contains a sustained BP. So there is presence of the sustained BP. So sustained BP will be greater than 185 by 110 mmHg, and this is despite the treatment. Next contraindications will be in terms of the bleeding diathesis. So in terms of bleeding diathesis, and also in terms of recent head injury or the intracerebral hemorrhage. In terms of recent head injury. So in terms of the recent head injury or the intracerebral hemorrhage. Then we move on to the in terms of the major surgery preceding 14 days. So it is contraindicated in terms of major surgeries in the preceding 14 days. Then comes the minor stroke symptoms. In terms of minor stroke symptoms, then comes the GI, gastrointestinal bleed. So there's a GI bleed which is preceding 21 days. Then comes the recent MI. In terms of the recent MI, that is a myocardial infarction. To learn and grow daily like this, please do subscribe.